Hello, I am Nurul Alam. I am going to examine your kidney by percussion and palpation. This procedure may cause slight discomfort but should not be painful. Please inform me if you feel any pain during the exam and ask patient, may I proceed? Greet the patient, tell about the procedure, wash hands and wear disposable gloves. Let's start the procedure. First of all, we start percussion of kidney. To tell patient, please sit upright and lean slight forward. And let's start the procedure. First of all, we put left hand over the costovertebral angle around T12 to L1 region on the patient backside. Using right hand, I gently tapped over my left hand, and if patient feel pain or tenderness, it may indicate kidney pathology such as infection or inflammation. If there is no pain, the finding is considered normal. Let's start palpation of kidney. Ask patient to take position, lie down comfortably on patient back and keep hands relaxed on your chest. Let's start the procedure. First of all, I place my hand behind the patient back, it's a renal angle area, and my right hand is placed on patient abdomen just below the costal margin, and ask patient to take deep breath. During inspiration, I gently press my right hand inward and upward to feel the kidney. Then I ask to exhale and I try to palpate the kidney by slight movement. Normally, kidney are not palpable in adults. If there is pain, it may indicate kidney disease. If a mass is felt, it could suggest enlargement